this session is I'm going to talk to Clara. So we're absolutely delighted that Clara is here with us today, to let us know a little bit about what it's like being a young person who's had mental health problems. As I say, I'm just going to ask some questions, and Clara's going to talk with me. So Clara, are you there?
Yes, I am. Hello.
Hello, fantastic that you're with us this morning. Thank you so much. So I think that we were going to start with just a little bit of you letting us know, what has been your experience as a young person with mental health problems. What could you just tell us a little bit about that?
Well, so my name's Clara. I started having mental health problems the start of the pandemic. I was going through a lot when the pandemic started, and my mental health problems did not just stem from there. It also stems from the fact that I have a genetic condition, so that makes things considerably worse on a daily basis, to do with anxiety and depression and other mental health problems.
Yeah, I remember you saying that sort of that the pandemic's definitely made things much harder for you, which I can quite see why it might have done. And one of the things that you've done recently is you've started to work with an organisation called Article 12, and I was just wondering if you could let us know a little bit about the organisation.
Okay, of course, Sean. Sure. So the organisation, Article 12, is an organisation that works with researchers, survey providers, new teams coming into the service, and all sorts of different things. So we review surveys, we review like leaflets, we review letters that are being sent out to young people, and yeah, all sorts of different stuff, Sean. Loads.
That sounds fantastic. And tell us a little bit about how many of you are working with Article 12.
Okay, so Article 12 has about 12 members. And we're all from different walks of life, different backgrounds, all that sort of stuff.
So you can provide this really useful service to any organisation that I think you said that wants some help with getting a sense of what it's like or what they should be doing to improve the way in which they communicate with children and young people who've had mental health problems. Is that right?
Yes.
Yeah.
Yes, definitely. And other organizations as well.
Okay. That's great. It sounds like a really, really useful service and useful for people in the audience to hear about, because you can help in a very practical way, help them get things right, I suppose.
Yes, absolutely.
Okay. And when we were talking before, we talked a bit about sort of the things that you think that that when people are working with children and young people such as yourself, the sorts of things that they need to pay attention to try and get right.
Well, I have a lot of points actually, so I'll start with my first point. Obviously. So my first point is that children and young people are going to be at one of their most vulnerable times in their life when it comes to mental health, because they're going through a service that they may not have heard of before. They don't know what's going to happen, and they need that reassurance from whatever service that they're going to have to go through. They need lots of support. So things like being able to open up when they want to open up, not when the therapist or organization wishes them to, because that can be quite daunting and upsetting if they don't have the right amount of time for them to, think, right, I'm going to open up now about what's going on. Also, the fact that children and young people need reassurance, you know, to say, oh, you know, it's okay, we're here for you, because they may not have had that in their situation before, so they need that reassurance, and that help to know that it's okay and that it's normal. Yeah. Another point that I have also is that when children and young people are accessing services, there is a lot of things that we young people don't want to happen. So things like you telling our parents all the stuff that we've said, because that can break the trust between the young person and the organization that they're working with, to help them get better. And also there is another point that I want to make, is that young people don't like a lot of jargon when it comes to letters or surveys. It really does not help them at all, because we're like, well, what does this word mean? The surveys and the letters need to be user friendly for young people and children.
And
Yes.
I can imagine that's super important, that actually when you receive something, that actually it's easy for you to understand. So no jargon, and simple.
Yes.
Is what I heard there. Yeah.
Yeah, that's very, very important for us, because, you know, young people don't have the vocabulary, the vocabulary that older people have. So it might be hard for them to identify what that means.
That makes sense. And I was also really struck by that that idea when you said, you know, that it was really important that people were there for you, and that people that you might not have heard that before, and that actually it was normal. And I just wondering if you could say a little bit more about that.
Okay, so I think the many young people and children struggle a lot with their mental health, because there is a lot of stigma around mental health and the way that you should get help, or the way that you should handle it, but there's no right way to handle it. So that's a grey area when it comes to mental health. And, you know, reassuring the young person and either the young people or the children that you're caring for, that they matter, because they might not have heard it from their household or their parents. They could come from a broken home where that isn't said too often, or they don't feel loved. So the connection between the therapist and the young person is so important.
Yeah, that's a really powerful sort of image for me, of that sort of making sure that that you try and get rid of some of that stigma, that and as you say, there's no right way to handle this, that actually this is very personal, and that the young person needs to know that the services that care, that actually there's somebody there for them, and
Yes.
that they feel heard in that.
Yes, I mean, it is paramount to their start of recovery, really.
Yeah.
That's how I feel. And, you know, also not telling the young people's or children's parents if they don't want something said. Because again, that can break the connection between the therapist and the young person instantly, and then they won't want to open up.
So there's something really important about understanding, you know, what can be said and what perhaps needs to be more sensitively handled than just telling everybody everything.
Yes, absolutely, because there may be some things that they've never been able to open up about, and that is the time between the therapist and the young person where they can do that, opening up fully. And if you try and restrain that by telling the parents or carers, then you're really going to dampen their start of recovery, I feel.
So we talked a little bit about some of those really, really important things that that make a big difference to a young person when they're accessing services, and also make a big difference to any of the people like me who might be then working with young people to help develop services, because the same sorts of things about sort of really listening and really understanding where the person comes from would seem to be really, really important.
Yes.
I was very struck when we talked before about this. I think you said that, you know, that people perhaps sometimes underestimate your knowledge.
Well, yes, absolutely, because I am a young person with lived experience. A lot of adults don't believe that young people can have that kind of knowledge, but you know, I certainly do, because I've been through it. So I think that adults need to be more open-minded, because we young people definitely do have knowledge. It's just we keep it to ourselves sometimes. So yes.
I think that's a really fantastic place to end on, Clara. That just sort of, it really, for me, that picture that actually you really do know, and you know in a different way than anyone else can know, and that actually it's only by other people being open that that will mean that we will understand and hear it, because as you say, otherwise you keep it to yourself. And this is absolutely, you know, this we need to make sure that the people that we're working with, that the children and young people we're working with, don't need to keep it to themselves, that actually there's a space to share it as well, so we understand.
Yes, and I would just like to say thank you so much to all the people who are listening. I really appreciate being able to come and talk to all of you today, so thank you.
Clara, thank you so much. It's a fantastic opening for our webinar today, and I know that you're going to sort of be here later on, and we'll talk as part of the question session. So yes. Thank you so much.
You're welcome. Thank you.
Thank you. So I think now we're going to, hello Non, yes, we've got Non here.
Hi.
So we're delighted to have Non here to talk a little bit about a mother's experience of being part of services with your son. And I think we're going to stop sharing my slides. And I'm going to turn my video off, and I'm going to hand over to Non to introduce herself in a bit more detail.
Thank you, Sean. Oh, just me on screen. Thank you very much, Clara. That was really, really inspiring to hear, and I definitely could relate to a lot of what you said in terms of my son. So thank you, and thank you all of you for being here today and giving up your time to listen to us to hopefully help future patients on their journey. So I've been invited to speak to you in my role as a parent of a child with severe mental health challenges. And I call it a role because becoming a parent carer for me was very much like starting a new job. There was so much to learn and understand, but unlike other work, however, there was no application process. There was no training, no manual, no holidays, no lunch breaks, and it becomes a vocation. It is a way of life. There is no such thing as carers in the same situation. We all have unique experiences. What parents and carers do share are the daily challenges of navigating the system and advocating for their child. They also share raw emotions and feelings, for example, worry, guilt, grief, desperation, to name but a few. And they share the isolation and exhaustion whilst trying to hold it all together. If they don't fight for their child, then who will? My son is now a young man. How that happened, I don't know, having recently turned 17. His medical history is complicated and confusing. From the age of 6, he was referred to specialists for many seemingly unrelated medical conditions. Teachers described him as quirky, and when we were told that he had a specific learning difficulty, his anxiety became difficult to manage, but when I reached out for help, I was dismissed as mother a worrier, and told, he's fine at school, the problems must be at home. Another time I was told, all boys have tics, he'll grow out of them. And when I shared family history details of a severe neurological disorder, in case it was relevant for my son's challenges, the response I had from the consultant was, I don't think so, have you been on Google? So I'd like to share with you some stories from our experience. These are snapshots of our journey, and much like a photo, I hope they capture more than just facts. I hope they reach out and connect with you. So I want you all to think back, April 2020, a week into our first national lockdown. Shock, disbelief, denial, panic, fear, and finally, reluctant acceptance. I'm sure we can all identify with one or more of these emotions. The world as we knew it stopped turning with no warning. How are we supposed to feel? I listened, as the nation did, to the unfolding horror of the COVID pandemic, and I heard the words lockdown, and I felt panic. I'd been here before. I was thrown back 5 years to a moment in my family's life when everything changed forever. September 2015 and the final year of junior school for my 10-year-old son. Week 1, he's looking forward to his final year and moving on with his friends to big school. Week 2, he freaks out in classroom and remains so agitated that he's admitted to hospital. He is sedated, anaesthetized, and undergoes tests for physical and organic brain damage. A week later, we are told that he has suffered a catastrophic mental breakdown at the age of 10. A month later, we were told that he has severe Tourette syndrome and will never return to mainstream education. My son became a prisoner to his anxiety in a self-imposed lockdown. Unlike the national lockdown, however, life continued for those around him. We felt as if we were caught on a slow-motion treadmill, whilst everyone around us hurried on with their lives. A strange detachment and isolation set in, and day by day, this way of life became our new normal, which we eventually accepted. My son and I were cocooned in a virtual safe world to enable his jarred mind to rest and recover. He was my constant companion, and his emotional well-being depended on mine. He needed to borrow from my reserves, whilst he built up his own armoury to enable him to step back out into the real world from which he was hiding. A world that knew nothing of his battles, the scars, the healing, and the courage needed to do this. I witnessed a very real and painful illustration whilst at a visit to Great Ormond Street Hospital with my then 14-year-old son. We had waited months for an appointment with the neurology and psychiatric teams. We had answered questionnaires, sent ahead years' worth of medical notes and background information, and we desperately hoped for answers, for help, for some meaningful support. An early start, 2 hours of traumatic train travel, and finally the call into the consulting room. 2 professionals greet us, 2 seats for us set in the middle of a vast clinical space. No small talk, no settling in. 2 hours of questions and more questions, exhausting interrogation. Then suddenly a closed door. Mum, can you wait outside while we speak to your son alone about his dark thoughts? I wait in a stark, glaringly lit corridor, staring at the closed door. What was going on inside my son's head? Why the pain? Questions over. We had done all we could to beg for help. A ruthless delivery of the verdict. Label after label, this behaviour, that behaviour, medication, training, courses, more referrals. It all swirls into an overwhelming sea of sounds, and I can feel myself drowning, gasping for air. We thank and we leave. We step into the cold lift. Another mother and son step in behind us, and the door slowly slides shut. The mother begins to sob, shaking with emotion. I put my hand silently on her arm and she turns to me. It's so hard. The fight is so long and so hard. It never stops. I know, I replied. The lift stops and the doors open, and it's time to face the world. So I hope these snapshots of our journey have given you an insight into the challenges and emotions that carers face. It was and continues to be overwhelming and exhausting. Following his breakdown, I was told that my young son's vast medical history had been a child's way of reaching out for help, and that despite my best efforts, he'd been let down by the professionals. No one had looked at the bigger picture and made the important connections needed for a correct diagnosis. The CAMHS psychiatrist initially diagnosed Tourette's syndrome, telling us, in my 10-year-old son's hearing, that he would have to be medicated as it was the worst case he'd ever seen, and sending us on our way without even as much as an information leaflet, but with the advice, I wouldn't sign up for support groups. They always tell you the worst case scenario stories. My son was referred to the National Tic and Movement Disorder Clinic at St George's Hospital, where he was seen by a world expert in tic disorders. In her opinion, it was unbelievable that he had not been identified as needing support at school and as being at substantial risk of mental ill health. I was told that early identification and intervention would have prevented the catastrophic breakdown and ongoing fallout that he endured. I keep huge files to store all his records, and I send paper copies in advance of hospital appointments to avoid repeating the difficult history in front of my son and to make the most of our short appointment times. When he was seen at St George's Hospital, their consultation notes were lost and the digital record accidentally deleted, so that our CAMHS psychiatrist did not receive the report for over 3 months. My son has since been diagnosed as having a complex neurodevelopmental delay disorder and eventually attended a specialist school on a part-time basis where he received all his therapeutic support. Once again, it fell on me to provide all the background information and keep the records up to date. On several occasions, I tried to organise direct communications between the education, therapy and health professionals supporting my son, but was told that it was not possible. My son has now, thankfully, left the world of education behind and is thriving in a supported apprenticeship where he is accepted for who he is. We saw yet another different CAMHS psychiatrist recently who hit the nail on the head when he said to my son, "Throughout school, you have felt like you are a problem. You're not. School was your problem." My overall impression as a service user advocating on behalf of my son is a system operating in silos and one where the voice of the carer is often dismissed because of our lack of expertise. My vision would be a transparent system which focuses on the patient and their carers and listens to their experiences in a cooperative and supportive approach. We need to be believed, not judged. We need understanding and empathy, and our children need a voice. So today I'm my son's voice. I have a couple of slides, if it's okay, Sean, to put up. I was asked to just think of what I would say to myself, what I know now, what I would say to myself starting on this journey. So I have a couple of slides of what I wish I'd known and what I wish you knew. Thank you. So, what I wish I'd known starting out on this journey. The first thing is, I wish I'd known to always keep home a safe and accepting space for your child. Leave the education and the labels at the front door. Let them be themselves and love them for it. You must pace yourself. I was told to prepare for a marathon and not a sprint. So accept help and be kind to yourself. And this one somebody told me early on, and I did take on board, which is take a photo of your child when you go along to multi-agency meetings. Remind them that your child is more than the labels they are given. Keep copies of everything. I think my experiences I've just shared with you, that one speaks for itself. Send follow-up emails after any meetings, health, social, education meetings, to confirm your understanding and agreed next steps. And don't be afraid to challenge. You know your child better than anyone. And what I wish you knew as professionals. Start off with, please don't make us repeat our story. Would you insist on breaking a person's bone again every time they attend a fracture clinic? This is the pain that it causes. Please don't call my child a case and call me mum. We don't want to be patronised and we deserve respect. Please believe us. We didn't ask for this. We wouldn't make it up and we wouldn't wish it on our worst enemy. And finally, what I wish for both my children, regardless of any challenges, regardless of any mental ill health. I wish that everyone in their lives values their uniqueness and celebrates their successes. So in summary, being touched by mental ill health in any way is an incredibly isolating and frightening experience. For me, it was difficult to know that people who could have helped, be they friends, family, or professionals alike, chose to step back. And this quote by Martin Luther King, I think, sort of summarizes that in the end, we will remember not the words of our enemies, but the silence of our friends. Thank you. Over to you, Sian.
Non, thank you so much. That was an extremely moving and heartfelt account, yeah, I'm enormously grateful for you being able to share that with us. It really, yeah, that idea of borrowing from your reserves, I recognize as a mum of somebody who has had significant challenges as well, and absolutely recognize that it's really hard. It's really hard to actually tell people what that's like. So thank you so much.
Thank you.
Okay, Cathy, I think you're up next. So Cathy, we've already introduced and it's got her own slides. So I'm going to turn my video off and hand over to Cathy.
Thanks very much, Sian. Hopefully that all looks okay. And huge thanks to Clara and Non for their really moving accounts. I think I have to take some deep breaths then to be able to carry on after, oh, excuse me, after Non's talk, which was extremely moving. So anyway, I'll try and get myself together. So my name's Cathy Creswell. As you've heard, I'm a professor of developmental clinical psychology at the University of Oxford, and I lead a group called TOPIC, which stands for the Oxford Psychological Interventions for Children and Adolescents Research Group. And we do a range of different research with children and young people, which is all focused on child and adolescent mental health, with a particular focus on trying to improve outcomes from and access to psychological interventions for children and young people. So we're doing a lot of work at the moment with studies that are focused on prevention and early intervention, particularly for anxiety disorders. So if you're interested in hearing any more about those, please do have a look at our website here. We also do a lot of work which is about just trying to increase the amount of research that's going on with children and young people and families to better understand how we can support families where children and young people are struggling with their mental health, as well as some projects where we're developing resources for families. And across all of this work, it's really critical that we're involving children, young people and their parents and carers in meaningful ways in everything that we do. And I think Clara and Non have made very clear why. And in some of the research that we've been doing recently, we've actually been working with young people from an organisation called the McPin Foundation, which supports people with lived experience in getting involved in research. And young people from the McPin Foundation have been working with our team and others to train up young people to interview other young people who've taken part in research studies. And what I want to do now is give you a bit of a snapshot of what we've learned from that interview study. And this has been a really wonderful experience for our team, who have had this opportunity to work very closely with young people as co-researchers. So the young people have been trained up to do the interviews with other young people about their experiences and to analyse the data, and also now are getting involved in writing up that work for publication so we can share it with others. So it's been a really fantastic experience for us to be able to work so closely with young people on this and really access their perspectives, both as interviewees and as also co-researchers. And I think what we've learned through this project is very relevant to anyone who's thinking about getting involved in research from a lived experience perspective, but also in clinical service delivery, because I think actually what we found definitely applies across those different settings. And equally, I think there's a lot of really important messages here for anyone thinking of working with children, young people and parents in their research or in developing their clinical practice. So essentially, from these interviews, some key themes came out. And these really highlight the potential opportunities that involvement in research and service development can offer young people. And so actually there can be some real benefits of young people of taking part in research, and our responsibility as researchers, as clinicians, is to make sure we're doing this work in ways that maximizes those opportunities and the opportunities that can be available. And so the things that young people told us were important to them and that they got from taking part in research were the opportunity to make a meaningful impact, the opportunity to be part of a supportive community, and the opportunity to learn and grow. And I'll say a bit more about each of those in a moment. And what they really emphasized was that in many cases, they'd kind of stumbled into getting involved kind of by accident, it almost felt like, or because they happened to know someone. And they really felt that the opportunities they had been extremely valuable, and they really wanted to see those opportunities being made much more widely available and much more accessible to other young people who'd had experiences of mental health difficulties. So just to tell you a bit more about the first theme, which was about having a meaningful impact, the young people really emphasised how positive it had been for them to be able to help others and use their time in a meaningful way. So for anyone thinking of getting involved, I think good to be aware that those benefits can come from it. But for people who are thinking about working with young people and parents and carers, it really highlights the importance of making it really explicit how the work that they're doing is making a difference. So making sure you're feeding back the impact that the work and their involvement has had and demonstrating that as clearly as you can. Young people also really highlighted the sense of achievement that they got and the pride they got from seeing the impact that their involvement had had. And also, it was really important to them to see things through. And as I was saying, make sure it's really explicit to them what has happened because of the work that they've done. And that by that way, you can really help young people get the benefit of the involvement themselves. So the second theme was about being part of a shared community and also having the opportunity to build relationships with peers. And so actually often these kind of involvement activities are conducted in groups. They don't have to be. So if people are uncomfortable in groups, there's normally other ways of working. And it's obviously important for us to be sensitive to that and make sure we do have ways of working that people are most comfortable with. However, these sorts of activities can create a really fantastic way to build relationship with peers. And it's really important that we set them up in ways that really facilitate that. Some of the things that young people mentioned are obviously online makes it a little bit harder to interact, form relationships. So we need to be thinking creatively about how we can encourage interactions in those kind of online interactions if we're doing it that way. Also, some young people highlighted that having very broad age ranges of groups can make it a little bit more difficult too. So having narrower groups can be very helpful. They also highlighted how it could be really beneficial to have a safe space where they feel comforted and supported. And I think this really picks up on some of the things Clara mentioned about, it's really important to recognise that people may be feeling very vulnerable when they get involved in this kind of work. And it's really important to be sensitive to that and make sure that it is a safe space to talk about issues and where people aren't forced to take part and they're supported when they are discussing sensitive topics, and really not forgetting the journeys that people have had prior to them getting involved in this work. And then finally, relating to this overall theme of a supportive community, how important it is that the researcher is able to connect and build relationships with those who they're working with. And I think that the young people really highlighted the really critical influence that the researcher in our case, or it could be somebody in a service setting, the critical influence of that person, and how it's important that they were warm and human, and we're able to build rapport with the young people. And I guess we recognize that maybe, you know, not everybody may feel comfortable with those kind of skills, but it really highlights the need to make sure that those skills are covered somewhere. So somebody in the team is definitely taking responsibility for that. And then young people also really highlighted the opportunity that involvement could provide to learn and grow. And again, so we really feel it's so important to make sure that when you're setting up involvement activities, you're doing it in such a way that really does enable young people to get that benefit. So some talked about that by being involved in research, in our case, they were helped in their journey to understand the value of their own voice. And this really relates, I think, to something that Clara said earlier about actually recognizing that how much knowledge there is and how much, you know, obviously very, very relevant experience there is that we can draw on and really make the most of. And because of that, and when that's done well, young people really can see the value of their voice and build confidence in their voice and in their skill set. Some also talked about being helped in their journey to learn about themselves and learn about others. They talked about developing emotional literacy, gaining social confidence, developing their communication skills. And others talked about how really critical it was that personal development was prioritized, and that actually we have a responsibility to make that happen so that young people can grow in their role as a young researcher. And certainly, you know, in this particular study, obviously, young people have really developed very strong research skills from their involvement, which will really help them, we hope, to get to where they want to be. So we're gaining some fantastic experiences for their CV, you know, building up skills for their professional careers, potentially having certificates or awards. And of course, it's really important that we're providing financial reimbursement so that people can take part, and it's, you know, they're not prevented because they need to be spending their free time earning money elsewhere. So I wanted to highlight all of those things. And then the final part, of course, was this message that, so actually by involving young people and families in research and developing clinical practice, not only is it really useful and essential for us, but it can provide a great opportunity for young people and parents, and it's our responsibility to make that happen. And so here they really highlighted that they wanted young people to know about these opportunities. They wanted us to be really reaching out, engaging young people, and making sure that they know what they might get from it. So emphasizing the benefits that we've described here, but making sure they're aware of the opportunities and that potential barriers to participation are addressed. If you want to hear a bit more about the study that I've just described, where we've worked with the young people from McPin to interview other young people, the young people and our team will be running an open lab meeting for the Emerging Minds Network on Monday, February the 28th. So please do feel free to join up for that if you'd like to hear more about that, and there'll be an opportunity to talk to the team who've conducted that research. But really, I think you know, the key people that you need to be listening to in relation to involving children, young people and parents and carers in research and service delivery isn't me. It obviously is people who've had that experience, so people like Clara and Non. And so I really wanted to share a quote with you from one of our parent advisors on the Emerging Minds Network, which I think really amplifies the messages that Non already shared. So I'm just going to be quiet for a moment and give you a chance to read through this yourself. So I think that very much resonates very strongly with many of the points that both Clara and Non made about just how critical it is that we work together as co-producers of services and research with young people and with parents and carers. And by doing that, we're going to provide far better research, far better services than we would if we tried to do it without those who have the most important voices. If you are a parent or carer and looking at getting involved in research focused on child and adolescent mental health, I'd really like to strongly encourage you. I think often that people feel that there are more and more opportunities for young people to get involved, but sometimes parents and carers can be left out of the conversation. And obviously, as we've seen in the quote there from Kirsten and we've heard from Non, parents and carers are a really critical part of the conversation. Through the Emerging Minds Network, which I mentioned, we have a number of special interest research groups which cover a broad range of different areas. And we, as the Emerging Minds Network, have provided financial support to these groups to enable them to involve people with lived experience, both young people and parents and carers, in their work. So please do have a look at the website, which I'll pop in the chat. And if any of those are of areas of interest to you, please do get involved. We also have other ways of working with parents and carers in more light touch ways, because obviously not everybody has the time to get involved in a very extensive way. So for example, one of our studies, the ICAT study, which is all about identifying child anxiety problems among primary school children and providing rapid, seamless intervention. For that, we have a Facebook group which parents can join. They don't have to be in the study. It's for anyone who might have an opinion on it. We share lots of useful information, and from time to time, we share opportunities to get involved and contribute to the research. So there are also kind of light touch ways. And for those who are coming from a service or research perspective, I'd really encourage you to think about ways that you can involve parents and carers and young people in a range of different ways to suit their particular circumstances. So I'll stop there, but if you would like any more information about any of the things that I mentioned, please do have a look at our website, but I'll just stop sharing my screen now. Thanks very much.
Cathy, thank you so much. I think that was a fantastic overview of a really comprehensive sort of body of work, looking at both at the sort of specifics of the research, but more specifically the sort of ways in which young people and their families can be involved, and the sorts of things that they genuinely get out of the process of involvement as well. So Non, if you would like to turn your camera back on, and we'll just have a bit of conversation. So there was a question that was aimed at Non and Clara, which was really, so what sort of information do you think should be out there, or what sort of things should it cover that would be helpful?
May I go first?
Yes, please do, Clara.
So there's lots of different topics within mental health that I think need to be talked about. Sorry, let me read can you repeat the question for me again? Sorry.
Yeah, no, just really, what sort of information would you as a young person find helpful to have available to you or to other people that you know?
I think definitely links to different services.
Mm-hmm.
Definitely links of contacts, I guess, for like all the different services that you might be accessing.
Mm-hmm.
And also I think having like pages where you can go and get information as well. I think that's very important.
Okay, so there's just something really just about finding out what's out there, sort of that
Yes.
isn't that easy to find at the moment.
Yes, thank
Brilliant.
you.
Thank you. And Non, does that sort of ring bells with you as well?
Yeah, I mean, what I would say is, because obviously we've been on this journey for 7 years now, and I think, I have seen improvements in that time. As I said, our very first appointment, we weren't even given a piece of paper to take away. It was just sort of off you go, and the signposting at that point, we kind of seemed to go round in circles, with the signposting. And also, trying to think where I was going with that one. Yeah, to actually have proper factual information as well, you know, not necessarily sort of sugar-coated information, just proper good facts. And to remember that when a child goes into a mental health crisis, the whole family are in crisis, so that even if normally we're able to access information and we're able to manage ourselves, it becomes very difficult. So support for the whole family is needed. I kept sort of waiting for, where's the SWAT team? You know, where are they going to come and who's going to take control here? And it's like, oh, it's me. So it was that kind of feeling, somebody to coordinate on your behalf. It would have been nice to have had practical help as well. It's all very well and good, the kind of, oh, you know, you can come and talk about it, to actually have somebody turning up and you know, giving you a break, or doing your ironing, cooking a meal, you know, that kind of stuff even. And also some to know about lived experiences, and I think this is Clara and Cathy have spoken about that. It would have been nice for us to have known it wasn't that unusual. It felt like we were the only ones, and that to be able to sort of hear, and also positive accounts of lived experiences, to know that there will one day be light at the end of the tunnel, would have been, you know, really helpful at that time. But I do feel that we're heading in the right direction, definitely.
So there's some light at the end of the sort of broader sort of tunnel of trying to get this right, in a sense, for services.
I do feel that, I mean, the very fact that we're sitting here having this conversation, and that patients are being sort of listened to, and I guess, you know, in a kind of silver lining type way, COVID has really put the spotlight on mental health. So it is now something that, you know, where, as you say, that unconscious bias, where people thought it wouldn't affect them, we're all seeing actually it can affect anyone. And interestingly, that was something definitely the unconscious bias, wasn't it, when you said about that, Sian, when we were first affected by it, there was very much this kind of narrative of, oh, well, you don't strike us as your typical, you know, family child who may sort of end up having issues, who may need help. And it was like, well, what does that look like? So that's why we were kind of brushed away with, oh, he's fine at school, you know. So yeah, I think talking about it, getting out there, getting it in the open, and being more open about it.
Yeah, no, that makes a lot of sense. And Cathy, do you have a sort of sense, a certain thing you want to add to that, sort of, you know, getting information or practical help?
Yeah, I mean, I think what we've heard from Clara and Non, you know, very much what we hear from families all the time, and I think, yeah, and you know, it's obviously really upsetting to hear, you know, Non's experience of quite how long it took to get that, and how many appointments ended with nothing to kind of go away with an action. And I think that so providing, you know, resources, you know, I think at one point, Non, you said something like, you know, we didn't even get a leaflet. So, you know, actually just sometimes providing quite simple bits of information, but something that people can go away, that provides good quality evidence-based guidance, can make an enormous amount of difference. And I'll just pop in the chat actually some examples of some resources that people in my team have been working on recently, which have been all about developing evidence-based resources for common mental health challenges for young people, addressing the areas that young people identified as their priorities, and then working with young people to communicate evidence-based advice and training up young people to do it. And so I'll share it just as some examples, because it includes some podcasts, it includes some infographics, it includes some films. There are some sort of actual full dramas coming with amazing young actors and actresses in those. So there are really wonderful ways of working with families to think about, you know, what these resources should look like, and make sure they're communicated in ways that are accessible, but obviously critically making sure that they reflect good quality evidence-based advice. So I'll just pop that in the chat in case people are interested.
Brilliant, thank you so much. I'm just going to get up and see. So I'm just wondering whether Non or anybody else has a sort of sense of you know, the way in which we might better incorporate people's experience into the way in which we design services, particularly, rather than just we've heard very, a lot from Cathy about the research space. I mean, how would it be best to involve people? And Clara's described a sort of great, organisation, Article 12, who does this. And any other thoughts about how we'd best do that?
Clara, did you want to go first?
Yes, only if you don't mind. Sorry, I've forgotten the question. Can you repeat it? I'm nervous, sorry.
we were just I mean, just perhaps if you could say a little bit about if people wanted to involve Article 12 in work that they're doing, how would they go about doing that? How would they get in touch? How would they, how does that work?
Okay, so Article 12 is part of Bananas. What you can do is search Article 12 on Google, and then you will find a link there that will lead you to the website where you can get all the different contact information that you can then get involved in.
Okay, so it's a really simple process. If people have got a leaflet or something that they want somebody to look at, they can just go to the website and put in a request, in a sense, for some help.
Well, I work with the main person that leads Article 12. She is always the one that the information comes through first.
Okay, got it.
So she I don't know whether I should say her name or anything, but yeah, she's the person that you want to speak to, and if you've maybe link that, then we can get her the
Brilliant.
people that want to come in. Yeah, sorry.
That makes sense. It gives everyone a very practical way of actually getting some input from children and young people. So what when we at the end of this, when we write out to everyone after the webinar, we'll make sure that we put all the links that are there. So the Article 12 link and the link that Cathy's just put into the chat, so that actually everybody can see where they can go for further help and support.
Yes, absolutely.
Brilliant.
So are you finished, Clara? Yes. It's a really interesting one about how you do involve patients and families, because I guess mental health, more than any other, once you're actually in the middle of it, you're not necessarily best placed to be involved in designing it, just the nature of the beast. It strikes me that one thing we need to get much better at is preventing it in the first place. So getting in there early, getting in there. I mean, our experience has been nothing kicks into place until we're in crisis. My son's gone into crisis a number of times, and it sort of ticks along, and then the warning signs, and then, oh, we're in crisis, and then suddenly, everybody's there to help you. You have sort of people, but it just would have been, made much better sense from all aspects to have got in there before being in crisis. And I wonder, when it comes to talking about it with parents and young people, does it need to be something that's embedded in school curriculum? Does it need to be something that really we are just aware of, so that we're not suddenly thrown into this oh, I don't know what this is about? We can see the warning signs, we're not completely derailed by it. And actually, involving people in design services before it even happens. I briefly helped with a young people's charity who we set up a peer support group. It was for parents and carers whose child hadn't quite reached the threshold for commissioned services. It was when parents were at that stage of something's not quite working here, and that the feedback we had from that was it was really valuable. It sort of helped prepare them if they were then going to need to move into commissioned services, but it also often helped just stop it sort of progressing any further, took away the fear element. So I don't know if that helps, but that's something that sort of really strikes me as being a way. It's a difficult one to get people involved. You either have them involved retrospectively, as I am, once you're through the worst of it, or I think proactively before you're even sort of embarking on your journey might be a sensible idea.
Yeah, and it is genuinely challenging for services to find the group of people to talk to. As you say, in the midst of crisis, it's perhaps not, that's not the time that's right for anybody to be involved in designing what next, but actually having a sense of yeah, how do you talk to a group of parents who may have concerns, or a group of young people who may have concerns, and what's the role of schools in that? I think there's a really interesting question there. Cathy, did you have something you might want to add to that?
Well, I mean, I absolutely agree with everything that Non's just said, and it's very much what we hear from families all the time. And certainly the involvement work we do, it will typically be, will be with young people or parents who've had a difficult experience, but where things are more stable. And then obviously at that point, they're able to engage more. And really, I think then try and, make the most of the difficult experiences that they've had by helping others going forwards. But we also have some projects where we've done exactly what Non was just describing, which are very much focused on early intervention, where we have worked with schools and parents and children in schools to co-design the procedures. So co-design how we screen in schools, how we give feedback to parents, how much we involve schools, how we then offer interventions in ways that engage parents, keep schools informed, but in ways that are acceptable to families. And so we've gone through a very detailed co-design process, working in exactly that sort of situation. So it's primary school, it's where there may not be, where typically people haven't accessed formal support, but often might be sort of wondering if it might be helpful. One of the studies is a prevention study, so it's actually even earlier, where people might not be worried at all, but it can give tools for later on. And we've had fantastic engagement in that, and certainly doing that work, setting up exactly how it was going to work by working very closely with parents was really critical, because we made a lot of discoveries and ended up doing a lot of things quite differently from what we probably would have done if we hadn't worked in that co-design way.
And I'm just picking up on some of the things that are in the chat here. I mean, somebody who's here, Emma's just saying that they've used Article 12 as a way to develop their name, logo, and actually their leaflets, so that that they're actually very consciously going out and seeking help. And somebody else saying, Natalie saying that actually they're developing new educational mental health practitioners who will work with children, families and school staff, so that actually it's exactly what Non was suggesting, that actually almost before there's a big problem, that that there is somebody that people might be able to work with at a school level. So there's a question here about or a couple of questions about what the purpose of the webinar was, and the purpose of the webinar, for those people who have asked the question, was really just to hear about the experiences of both service users and families, about the sorts of things that matter to them when it comes to the way in which people might work with them, and to have some practical sort of advice about how Cathy's team has done that in practice, on the grounds that actually the things that matter are quite similar, no matter whether you're talking about a research context or a service delivery context. So I think I'm just going to sum up, because we've got just a couple of minutes left. So, I mean, the first thing to say is enormous thanks to Clara, Non and Cathy for sharing their experiences about working with services or working with other organisations to try and get the voice of both people who have used mental health services or who have had experienced mental ill health, either themselves or within their families, and what that's like. And I guess the sort of things that have come out for me really is that, as we saw at the beginning, this is a common issue. This is not something that is extraordinary. It can happen to anybody, that they either themselves as a young person or somebody in their family can have mental ill health problems. But the really, really sort of fundamental thing is that everyone's unique, and that we're not cases, or we're not numbers, we're not mums, we are people within that, and they're people who know themselves, and that means that actually what they say really matters and needs to be listened to, and or know their loved ones. So people need to listen and believe what people are saying, give people space to describe and get to the point where actually they feel they can share without any judgment, acknowledging that there's still an awful lot of stigma out there around mental ill health. And that there's no right way of doing this. This is, this is about the way in which it is possible to do things for any one individual at any one moment in time, and that there has to be an absolute recognition of quite how hard it is. And that means that you have to create safe spaces for people to be able to say what it's like just in the terms of their own mental health at this moment in time. But also, if you want to involve people, you have to create safe spaces to allow people to share what are often difficult and very painful experiences and emotions. Absolutely goes without saying, it's always true that people need to talk to individuals and write to individuals in a way that they are likely to understand. And so hence, check out your leaflet, check out your referral letters, check out your discharge letters to make sure that those are written in such a way that are understandable to both families and to the individuals themselves. And that there's something, that there's something really powerful about young people being involved, or families being involved in designing services or designing research, which is about understanding the value of their own voice, that actually that it is possible to make a difference, and that in itself has its own benefits. So I think that is probably all from us. And I hope that you've enjoyed the webinar. I always do. And just a reminder to say that we've got 2 others coming up. I think the next one's on March the 31st, which is with people with autism and their families. If you want to sign up, there'll be we'll send out a link, and it would be great to see you all again sometime in the next few weeks. So again, very, very many thanks to Clara, Cathy and Non, and bye from us, and hope you have a good day.